we're coming from America. We're like, dude, we can do it. We can save this patient. But no, there's nothing you can do. There's literally nothing you can do without the resources, the medicines that are not coming in, And that's the reality. Like food is a huge problem, obviously not coming in, but medications, supplies, surgical equipment, it's just not coming in. And, we would try to bring it in our, 50-pound carry-on bags and whatnot. But what is that going to do, right? You're talking about 2.2 million people. You're talking about 6 doctors trying to save the world. I mean, it doesn't make sense.
Dude, when people come in, are they coming in on stretchers? Is there like a nurse desk or anything like that? Like what's kind of like the setup there? Does it feel like a regular hospital?
It does, but the difference is there's an ambulance here and there. But majority of patients are coming in on donkey carts and private vehicle, which is like they stuff like 4 or 5 bodies in the back of the car, and then families are just holding their loved ones and just running inside through the double doors and plopping the patient down wherever they can find them. Sometimes in the wrong area, then they have to pick them up and move them to the critical area versus the green area I was talking about before, and it's chaos like that, right? But yeah, when the traumas come in, it's just it's people running all over the place. It's not as much organization as you would imagine in an American hospital.
Is there enough blood, like for blood donors and blood draw, like that sort of thing?
Yeah, so sometimes it runs out. Sometimes Israel allows a mass donation from the West Bank, for example, to come in. We physicians are encouraged to give our blood upon leaving, so we don't get too fatigued when we first get there. It's at the end that they encourage us to give.
If someone is dying, can they still take blood from them to save it and give it to someone else?
Yeah, I don't know if that's a standard protocol there. I don't think that's established protocol.
Is that even possible? Like, is that a...
Yeah, it's possible. But it's kind of an interesting concept. Like, hey, you're dying. Let me just take some of your blood. But I guess in an emergency, that could be done. I think it's more like respecting the dead. Just, you're going to die, let them die in peace.
Yeah. Yeah, for sure. I just didn't know if somebody had died, if you could, like, while their body, could you still take blood from them?
Yeah, definitely. Yeah,
how long is blood still able to be taken out of a body? Let me see. Taking blood from a dying person, specifically for donation, is highly restricted and governed by strict ethical, legal, and medical standards worldwide. The dead donor rule, a fundamental principle called the dead donor rule, requires that a person must be declared legally and medically dead by recognized criteria, such as brain death or cardiac death, before any organ or tissue can be removed for donation. Blood banks and medical organizations do not take blood from dying patients for donations, and this would violate ethical and legal norms. Okay.
I mean, that also applies to any country that is not going through a genocide.
Yeah, that's what I'm saying.
So that's what I'm saying. Like,
the rules might be a little bit different there.
Like Al-Shifa Hospital in the north, like I said,